Hey, what's up, guys? I just want to show you this cool report and this cool new tool that we have in the office here at Shift. And what we actually got was a 3D scanning kiosk from Foot Levelers for custom. They call them Spinal Pelvic Stabilizers, which is really cool. So the reason we did this, number one, is for clinical increase of clinical outcomes. Like, we're just always trying to get better results. We've started to learn more and more about the gait and the feet and how that's affecting things like the knees, the hips, the pelvis, and obviously leading up into the spine. And so this just continues our journey. One of our core values is cutting edge knowledge. And so we are never going to stop learning. We're never going to stop improving. We're always trying to do the best by our patients and get the best outcomes that we can. So that's what this is about. What I'm showing you here, so we do have a scanner. It does a 3D scan of your feet and how you stand. And are your arches collapsed? How does this affect the knees, the hips, the spine, the pelvis, all of those things? So this is actually my wife's scan that I'm showing you right now. So if we're looking at this, just going to point out a couple highlights, right? So we have the optimal scan on the left, right? All of our arches should be supported, so we shouldn't have any red amount of pressure through these arches. So we have the longitudinal arch here, we have a transverse arch across the top here, and then a medial arch as well. You can see she is collapsed on the longitudinal arch on both sides, and also a bit coming across on the transverse arch as well. So you see it gives you a couple different scores. It gives you a pronation stability index score of 100. That means she scored in the moderate range, which definitely recommended for custom orthotics. But a big thing I want to point out here actually is the arch height difference. This is a big deal. This is maybe the most important score. You can also see it up here, 12.59 difference from left to right arch height. We want it to be less than 1. Okay, so that is a big deal. The reason that's a big deal is it ruins symmetry and it ruins balance in the body. This is why maybe only your left hip hurts, or only your left knee, or only your left ankle, or only your left foot. That's the reason these things happen, is from asymmetry, and we're not balanced. Right. So for my wife specifically, she's actually been struggling with some left hip pain, which led us partially down this path as well. As looking at this, we found out she did have a short leg, so she's been wearing a lift, which has helped a lot, but there was more to it. And so the problem is, if the arches collapse, it leads to rotation of the knee, rotation of the hip. It can lead to this shearing force that's happening, and a lot of issues. So this is something we're now going to be screening for in a lot of our patients, especially if it's suspected that we have some type of an issue there. We actually have a lot of research now showing that collapsed arches contribute to posture. So even things like forward head posture and different issues that we see, we're going to be able to fix even better with these custom orthotics, or as we like to call them, spinal pelvic stabilizers. So if you have any questions about this is a new thing we have in the office. Anyone can get scanned. We can see where you score, decide if we want to go with some custom orthotics. But this is just kind of an intro video letting you know of something that we are implementing now. We're super excited. Again, we never stop learning. We're doing the best we can to help our patients on a daily basis. So hopefully this is exciting for you guys, exciting for me, because I'm a nerd and I love this stuff. But post any questions you have below. Thanks a lot.